So Vinny, we're here at our annual meeting, 2024 here in Orlando. What do you think of the meeting so far?
Overall, I think the meeting's been great. I think in general at the FUS we have a great meeting. Um, I think both the scientific program and the socioeconomic session have been very strong. Fortunately, in Florida, we have a large number of great urologists who are actively involved in various scientific programs at institutions and are involved in advocacy and are good representatives for all of us as urologists from Florida. And as always, I'm really excited to be here and to hear them speak.
And you're always here.
Yes,
When
it's
you're not
true.
here, it's like, wait, where's Vinny? And then they're like, oh, he's on call. I don't even think you take call anymore. But you've seen the organization evolve. For someone that is hesitating about coming to our meetings or being involved, what would you say to them? Like, what's your elevator pitch for FUS?
I would say that you don't know what you're missing.
Yeah.
I think that the Florida Urologic has a lot to offer a urologist from Florida in many ways. I think just most commonly we think about things that we do in terms of the practice of urology, different care items and scientific presentations that involve them. But I think it's very important for everyone, for all of us to know in Florida, whether we be in any variety or type of private practice or a more academic type of setting, academic institution, that there is now a very large number of factors that impact us as urologists both at the national, state, and the regional level. And I think it's really upon all of us to be informed about what these issues are, to really help us improve our practice, maintain our practice, and plan for the future, because things are always changing.
So let's take a step back in a time machine. Your first day after you've finished all your training, and you are now in attending. What is the one thing you wish you knew then that you know today, or that you've learned today?
I think that from that time, I think I trained in a time where training was very much focused on, of course, the practice of urology and, of course, learn about urologic disease. But back then, we did not have much training or any type of time spent to really tell us how the practice of urology actually worked in everyday life. And so there's a lot of aspects of parts of urology in terms of how we interact with both federal and state agencies and regulatory agencies, things that largely impact your practice. I really didn't know much about those things, and I learned a lot about all of those things in the Florida Urologic Society. And actually at the current time, I'm with the Southeast Section and the AUA as part of our health policy committee. And because even being an academic urologist and being focused on teaching and doing my research, I think it's very important for all of us to be involved to really maintain our specialty for the future and make sure that our specialty is strong, especially for those who are coming after us to maintain a strong future for urology.
I completely agree. I finished my training days in 2013, and I would say even my education on the business aspect, even like how do you integrate technology and contracts and working with administration and essential leadership skills, they were there, but they could have been better. But it's kind of hard because you're so focused on just learning how to operate and learning how to manage urology patients.
Correct.
So I'm glad you shared that. Now you mentioned health policy. I think it's very important, but I don't like going to DC and policying and advocating. Why do you think it's important that me, you, we all should be doing that?
Well, I will tell you, it is a great question that you ask, because I have now been to DC with the AUA health policy team and as a member of the committee, and with various urologists from the state of Florida, as well as urologists from all the other states. And one of the items that occurs there is that we prepare ourselves by learning all the specific information and what is happening with different items that impact us as urologists. And then we go, in quotes, up to the hill.
Yeah.
And you walk through the halls of Congress and the Senate, and you meet many of their staffers. Many times I've met congressmen, congresswomen, as well as senators themselves, and they will tell you what we can do as physicians to make our viewpoint known. And to your question, one of the most important things they always tell us is that we need strength in numbers.
Yeah.
We need to convince people that these are priority items that are impacting all of us as urologists, right? But not only impacting us as urologists, but then that impacts the care that we give to all of our patients. So, who of course are their constituents, and so I think it's very important for us to be involved for this reason. And I think we live in an environment today where, of course, we all want to perfect our art of medicine and urology, but this is also a part of what we have to do for our specialty.
So we want to perfect our art of medicine. We want to perfect the care we give our patients. But while we're pursuing all that, sometimes we lose balance. So how do you keep yourself balanced when it comes to work life, your hobbies, and everything else?
I think that's a great question. I think that's a challenging question, and it's not an easy thing to do. I think we all have maybe slightly different obligations or priorities, so that can change for individuals. For me, I have 4 children. My family, my wife, my children are very important to me, and I always want to make sure that I spend enough time with them all as a father and a husband. And it's very important to me that I take part in the childhood experience that my children have, to make sure that they grow up in a way where they can be good, strong individuals and succeed in the world. So I make it a point to have time for that. But I have to balance that with my clinical work and research that I do. And then, of course, as we all know, we then commit more of our personal time to various activities and societies like we have here. But I think a very important point is that you have to set boundaries on how much time or resources are given to any certain thing. And it's very important to let everyone know that you work with that you have these boundaries because you have obligations to all these different things that we're talking about. And I think you have to set those boundaries. And sometimes we may individually find that hard or challenging to do. But if you don't do it, you invariably will run into a variety of disappointments or difficulties with the various entities that you're involved with if you don't set reasonable expectations.
Yeah, I think boundaries are very important. Yeah. I'm glad you mentioned that. I'm not good at it, but I'm improving every single day and setting that boundary with saying no for things that come my way, and then making sure I always say yes to things my kids may need. Well, not all the time, yes, because sometimes they ask for things. But I've always wanted to ask you a question. This is going to be my final question for you is, how did you get into the stone world? Because that's all you do. You do complex stone disease. There's so many things in urology, but I wouldn't say a niche. It's probably more of a passion, but I've always wanted to ask you, like, why? Did you get interested in other things, and why just focus on one thing?
Well, it's a great question, and I can tell you how it actually all happened.
Yeah.
So when I first trained in urology, I was at the University of Miami, and one of the faculty there was Dr. Raymond Leverly. And Dr. Leverly was actually one of the, would probably still be considered one of the first generation pioneers of what we consider modern day endourology. He was actually trained by Dr. Hulbert at the University of Minnesota, where a lot of minimally invasive devices, both for urology, cardiology, and other specialties were devised. And so he was part of that generation. And then he very much inspired me when I was training as a resident. So I was fortunate to have a very strong experience with endourology very early on. From that inspiration, I then did a fellowship. I went to the University of Iowa with Howard Winfield. And at that time, that was a time where not only had endourology been starting to grow, but that was actually the dawn of laparoscopy for urology. And it turns out that
We're not going to ask you your age here, Vinny. Don't worry.
Thank you very much. And it turned out that my fellowship mentor, Dr. Winfield, actually was the pioneer of a number of laparoscopic procedures in urology. Many of us know Dr. Clayman. Actually, Dr. Winfield originally had worked with Dr. Clayman at WashU and had helped devise the urologic procedures to be done laparoscopically in animals. Yeah. So to your question, I then had a large experience with endourology and laparoscopy and eventually robotics as well. As time went by, I think what made me finally sway more towards the world of endourology and stone disease is I also have a great passion for research. And I had met a number of individuals at the University of Miami where I had returned to after fellowship. And I had some great research opportunities. And I think that research just led me more down the road to just take care of patients with stone disease in more detail. And then the final part of that was after being at the University of Miami on faculty for around 10 years, I was contacted by the University of Florida, who at that point were really starting to grow their urology program. They had gone from a division of general surgery into becoming a department. And they needed someone to lead endourology and stone disease. And for me, I thought the timing was actually ideal. And so I then went to the University of Florida, where I again had a wonderful opportunity to be part of a great university infrastructure that now involves basic scientists, engineers, other clinicians, nephrologists, and a number of individuals who I have weekly research conferences with in research of endourology and stone disease. So to your question, that's how it all came to be. Yeah. And it's been a great road.
Yeah. Well, just to let you know, I have a history of kidney stones myself. I watched my stone for about 4 years, and then it attacked me while I was at the gym, and it's very painful. Stents can be painful.
They are.
Stones. So I do everything I can to prevent stones and make you happy and avoid having to come see you one day.
It sounds like you're doing a good job.
But thank you for joining us at our annual meeting, and enjoy. Thank you.
Thanks for having me.